A call has just come through from paramedics, rushing in a man who's been stabbed in a violent attack and could be bleeding to death.
So let's get the room ready. We're going to go into trauma 1 or 2? Trauma 1. So we know that there's a man coming who's coming in police custody who's been stabbed on the left-hand side of his body. And we anticipate that things might kick off in terms of not wanting treatment, not wanting to be there, being scared, having pain.
The man is under the influence of alcohol. He's extremely agitated and police are standing by.
Back out. Ready, set, go. Okay. He says he was stabbed twice. Not sure where it happened. Went home. It's difficult to assess the depth of his wounds. He's reluctant to take close. He's got significant thoracic pain. Says it's sharp. Says he stops him taking a deep breath.
The man waited 2 hours after the attack before finally contacting a family member who convinced him to go to hospital.
I'm going to lay him flat. Let me have a look at his heart. I don't know if the stab wound's gone into his chest or his tummy. And so that's why we're trying to get the ultrasound and figure out if he's bleeding internally. Once I've done the ultrasound, I'll sit you up, matey, okay? I just want to get an ultrasound of you, and I won't do that for long. To be able to figure out if he's got bleeding within his abdomen, we need to lie him flat. I'm really trying hard to get him to trust me, but this patient's really agitated, and so that is proving really difficult.
Just wheelchair up, please.
You want to go up a bit? All right, no problem. How about that? Maddie, I want to let you know why I want to lay you down. Because the ultrasound only works if you're laying flat.
Give me the morphine.
I'll give you the morphine, and then what I'm going to promise you...
water, please, mate.
I'm going to get you something to suck on in your mouth.
Drink, please.
This man has a lot of pain with breathing, and so I know that things have gone deeply into his body. I just can't figure out if it's into his chest or his belly. He is really scared, but I'm realising that he doesn't understand the severity and the life-threatening nature of the stab wound.
I can't lay down, I'm telling you, it hurts.
We'll give you some medications.
There's much pain there when I go down. Please take this off.
And I don't know who stabbed him, but they'd stabbed him such that he could bleed to death.
Surgeons are standing by, but they need conclusive ultrasound results before operating.
Hold my hand, you can twitch if you like.
Go back up.
We will in just a second, okay?
Hold on.
Some pictures, yeah.
There's a little bit of free fluid there.
Come on, mate, please.
So there is a little bit of free fluid. All right, matey?
Yeah. It's a job.
Hey, mate, I reckon you've been stabbed in the belly, and I reckon it's popped into your tummy, and I reckon it's bleeding. You'll get sick and die if you don't have an operation. We're going to knock you out for an operation.
Give me a drink first.
No, not at the moment. We can't do the operation if you have water in your stomach.
I'll give you some rice. Here you go.
I want
For yours.
The team deny the man a drink as the fluid could end up in his lungs and he could choke to death.
I just need a drink and I'll wait. I'll help me
I'm
out.
happy to give you ice. There isn't anything else we can do.
Just give me a drink.
The patient is becoming increasingly aggravated.
If things get out of control, we have to be careful for our staff safety to make sure that everyone's safe and the patient's safe. I know he's been stabbed and I know he's bleeding internally and I know that he's not able to make the right decisions for himself, and so my job is to take control of the situation, so take the choice out of it for him.
Dr. Emma makes the decision to sedate him.
I'm giving you some medication through the drip, okay? It's called ketamine. Have you heard of that before?
No.
It makes you feel a bit weird, but we're here to look after you, all right?
I'll be gone in a minute.
Hope not. We're here to look after you, mate. This man needs sedation and he needs a drug that won't affect his blood pressure and heart rate. So I've given ketamine. You just relax. I'm just going to lean you back a little bit. Not too far.
Good.
I've gained control of the situation now, but I get the feeling that I can't just relax.
All right, yeah. All right, home break, please.
In Trauma 1, Dr. Emma West has called for urgent help with her out-of-control stabbing victim.
So I need you to hold him down. So I'm going to give him a couple of milligrams of Medaz. I think he's having emergence reaction from the ketamine. Now, you hold his arm down. Where's that Medaz? Good.
It's taken 6 security staff and police to restrain the aggressive man.
When he jumped off the bed, I screamed out for some help, called a code grey, and I knew that would result in security staff who are expert trained at helping me hold down a patient like this so that I can give him sedation so that he can get urgent care that he needs.
You've got 10 and 10 there.
Thank you. It's all right, it's okay. He's an injured man. We just need to be really safe with him. And he's had some medications that have... He won't listen to you. Because he's really sick. So I need to put a drip in there. So hold him there and hold that arm out. Good, thank you.
The sedation is beginning to kick in, but its effects will only be temporary.
So I think if we wait for his sedation to wear off, he's going to wake up and just be really, really difficult. So I think we need to get control of the situation. We can't reason with him. We can't get him to lay flat. We can't get him to do what we need. So I think we're going to have to intubate him now. You've got theatre ready?
They are aware.
Okay.
In order to keep the man unconscious, Dr. Emma decides to take over his breathing and put him into an induced coma.
I was trying to meet him and talk to him so that maybe he felt that he had an ally, but his brain wasn't working that way because drugs, alcohol...
I can see untitled trace.
Yeah, there is. I see now.
Yeah.
With the patient now under control, Emma's job is done. Whether he lives or dies is now in the hands of the surgical team.
I think you should start rolling. And there's lots of blood in his belly.
As he leaves the emergency department and heads upstairs to theatre, Emma's intense shift ends with paperwork before she can clock off.
My drive home is a little bit of wind-down time. Things percolate through your mind. You think about the case for a bit and you think, could I have done that differently, or did they get enough pain relief? So it's just that 45 minutes I find so important, because then I walk into the whirlwind of 4 kids all wanting my attention as soon as I walk in the door. And, you know, I'm their mum, so I have to be 100% ready for them too.
All right, home break, please.
Dr. Emma's aggressive stabbing victim survived the violent attack. Thanks to her team in emergency, he was rushed to surgery where the internal bleeding was stopped and his stomach repaired. He spent a few days in hospital before checking himself out. He didn't return for any of his follow-up appointments.